not only seen, but deeply felt by community health centers and organizations like ours around the country. And of course, we extend our heartfelt thanks to our very own Representative Troy Carter. Congressman Carter, your unwavering advocacy on behalf of Louisiana's 2nd District and your dedication to protecting Medicaid and strengthening public health systems continues to make a meaningful difference in the lives of so many. At Crescent Care, our amazing 275 staff provide primary and preventative health care, dental and mental health care services, HIV and harm reduction services. Like all 1,400 community health centers around the country, we provide high quality, accessible, and affordable health care to our community. This comprehensive care offered by health centers saves the overall healthcare system $59 billion a year. Community health centers are part of the answer to a complicated healthcare system. I would also like to recognize the organizations of the CARE Coalition that brought together our Louisiana legislators to support Medicaid. Louisiana Primary Care Association, Volunteers of America, United Way of Southeast Louisiana, New Orleans Health Department, Invest Louisiana, and the American Cancer Society Action Team work with Louisiana lawmakers from both sides of the aisle to pass Senate Concurrent Resolution 32, a clear bipartisan message to Congress. Medicaid is essential to Louisiana. We should be working together to strengthen it, not weaken it. With over 1.6 million Louisianans relying on Medicaid, including nearly half of all children, this bipartisan resolution called for thoughtful, evidence-based reforms, not deep, top-down cuts. Despite the tireless efforts of many, the reconciliation budget bill recently passed in Congress, with dangerous implications for Medicaid. These changes threaten to roll back decades of hard-won progress in ensuring access to care. We know the work ahead will be difficult. Crescent Care is committed to work along with all of you, federal, state, and local partners, to ensure these policy burdens do not cause needless harm or create new barriers for our patients to access the medical care that they need. Medicaid saves lives, and so do the people and programs that support it every day. To Speaker Jeffries and our visiting congressional delegation, thank you for bringing your leadership to Louisiana. Thank you for continuing to carry forward the message that public health is not a partisan issue, it's a human one. Welcome to Crescent Care, and I'll turn it over to Troy Carter.
Alice, thank you very much. Thank you for allowing us to be here today, and more importantly, thank you for your incredible leadership. I'm very honored to be here today with four of my outstanding colleagues. House Democratic Leader Hakeem Jeffries from New York, Representative Nanette Barragan from California, Representative Robin Kelly from Illinois, and Representative Debbie Wasserman Schultz from Florida, all of which you will hear from shortly. Good morning, everyone, and thank you. Alice, thank you for welcoming us to the clinic right here in the heart of New Orleans. Crescent Care is a place that embodies the spirit of community-driven, compassionate health care. After yesterday's town hall meeting, we heard firsthand the deep concerns of Louisianians about the healthcare futures, and it's clear we face a serious crisis. The passage of Donald Trump's big, ugly bill, H.R. 1, represents the most devastating attack on America's health care in our nation's history. It cuts more than $1 trillion from health care, including $500 billion from Medicare, putting millions of Americans, including many here in Louisiana, at risk of losing coverage, facing skyrocketing costs, and seeing essential providers shutter their doors. What we know this means, what this means to us is our communities will be irreparably harmed. More hospital closures, longer wait times, worse health outcomes. It means seniors, children, and people living with disabilities will all suffer. All Republicans can deliver massive tax breaks so they can give massive breaks to the richest of the rich on the backs of working Americans. It is a reverse Robin Hood, taking from the poor to give to the rich. It simply isn't right. But we are backing down. A part of why we're here today and having my illustrious leaders here with us on the ground in Louisiana is to demonstrate that while the first round may be out, this battle is not over. This war is far from over. They may have won the battle, but they will not win the war. The people of America are speaking, and they're recognizing, and they're learning more every day about what this big, ugly bill actually means. Together, we will fight these harmful policies in Congress, in courts, and with you, the community. And we need the power of community to step up. Your voices to hold Republicans accountable to the harm of this bill. We will not follow the edict of Mitch McConnell, who said they'll get over it. No, we won't. We won't get over it. We won't get over it, and we'll fight to the very end to make sure that we cancel this big, ugly bill. And that happens with a change of heart, a change of education, a change of people recognizing that this big, ugly bill not only hurts Republicans, it hurts Republicans, Democrats, independents, and the like. And we're hearing more and more from our Republican citizens who are coming to our town halls. Why? Because their members aren't having town halls. And we welcome them because we represent all people. Healthcare is not a right, it's a privilege. Here in New Orleans and places like Crescent Care, we're standing strong, standing with you, standing beside you, standing in front of you, standing with you in every possible way. And we'll keep fighting until every Louisianian, every American has access to quality, affordable health care. It is our duty, and we take it quite seriously. Ladies and gentlemen, it is my distinct honor and privilege to bring to the podium someone that certainly does not need an introduction, someone that has led with honor. I'm so grateful to call him my friend, to call him the minority leader and soon to be Speaker of the House. Someone who demonstrates the grit, the compassion, and the intimate knowledge of what it takes to fight for all Americans. Ladies and gentlemen, give a big round of applause to my friend, your friend, our leader, Congressman Hakeem Jeffries.
Good morning. It's an honor and a privilege to be here in the great state of Louisiana, in this all-American city. Certainly thankful for the leadership of Congressman Troy Carter, for his partnership and his friendship, standing up, fighting hard each and every day on behalf of the people that he is privileged to represent here in Louisiana's 2nd Congressional District. Let me thank Alice and the people at Crescent Care for the work that you do on behalf of the people in this community and all across the city and the state to ensure that they have access to high quality care that is both compassionate and comprehensive. And our commitment is to make sure that we fight for every single person in this state, every single American across the country, to ensure that they can get the high quality, affordable health care that people in this country, the wealthiest country in the history of the world, deserve. We believe that access to high quality and affordable health care shouldn't simply be a privilege available to the wealthy and the well-off. It's a right that should be available to every single person in the state of Louisiana and every single person in this great country. Unfortunately, the one big ugly bill that has been jammed down the throats of the American people represents the largest assault on Medicaid and health care in American history. The one big ugly bill will have devastating consequences for the people of Louisiana who rely upon Medicaid to get their health service, to address their medical needs, to be able to live with dignity and respect in a nursing home setting, to have hospitals that are available to them and not closed, particularly in parts of rural Louisiana, and to be able to get the type of compassionate primary care that exists at community-based health clinics like this one. But this struggle is not over. We're just at the beginning. We're going to fight hard to make sure that the devastating Medicaid cuts that are now part of this one big ugly law that has been signed can be pushed back, not for Democrats, independents, and Republicans, but for all Americans. That is our struggle. That is our commitment. That is the fight that we are waging on behalf of the people of Louisiana and on behalf of the people of this great country. The Louisiana State Legislature, in an overwhelming and bipartisan way, passed a resolution making clear that cuts to Medicaid will be devastating for the people of Louisiana. Whether you're in an urban part of the state, a suburban part of the state, a small town part of the state, a rural part of the state, it will be devastating. These cuts to Medicaid, to the people of Louisiana. The assault on health care is unacceptable, unconscionable, and un-American. And I'm thankful for the leadership of Congressman Troy Carter in standing up for the people of this great state and helping to work with people from all across the political spectrum to do what is necessary to push back against the cuts that have now been enacted, to educate the people of Louisiana and throughout the nation as to how damaging this one big ugly bill will be to their quality of life, but most importantly, to assure everyone that our commitment is to continue to show up and stand up and speak up for your health care, for your quality of life, for an America where when you work hard and play by the rules, you can live a good life, have a good paying job, good health care, good housing, good education for your children, and of course, a good retirement. That is our commitment to you, and we will not stop fighting until we can end this national nightmare and bring about an America that is the best version of herself. Thank you very much. It's now my honor to yield to one of our distinguished co-chairs of the Steering and Policy Committee, who of course participated in the town hall meeting that we held under Troy Carter's leadership last night, Congresswoman Debbie Wasserman Schultz.
Thank you so much, Leader Jeffries, and to Congressman Troy Carter, who does a remarkable job on behalf of his community. Louisiana, too, should be very proud having his strong and resilient voice representing you in our nation's capital. And he sits on a key committee, the Energy and Commerce Committee, that focuses on the policies that were directly impacted by this bill. In fact, my fellow co-chairs of the Steering and Policy Committee sit on that committee as well. So you've got appropriators and any Energy and Commerce Committee members in the House here who focus our work every single day on making sure that there are resources available for people who need to make sure that if they're sick, they can afford to go to the doctor, and policymakers who fight every single day to make sure that that policy reflects an ability to take angst and stress off the table, which is the opposite of what this big ugly law has done for 17 million people who have now lost their health care as a result of its enactment. I can tell you in my home state of Florida, out of the 17 million people that will now lose their health care as a result of this law, 2 million of those are Floridians, 90,000 whom are from my congressional district. And it's our job now, because talking about millions of people and thousands of people, people can get lost in the numbers. It's our job to put human faces. And that's what we're going to do as we travel under Leader Jeffries' leadership across the country, put human faces and share the personal stories of the experience and impact that this bill will have, devastating the lives and causing people to lose their lives as a result of not having access to health care. And I can tell you, as someone who 17 years ago, at 41 years old, after doing a self-exam in the shower and finding a lump that had not been there before, as a young woman, I heard those terrible words that no one wants to hear: you have breast cancer. And I remember thinking immediately after I realized that I went from being the picture of health on one day to a cancer patient the next day, out of the clear blue sky, that I was so thankful that I had health care coverage, that I did not have to worry what I was going to do next. I was able to go right to the doctor to make sure that I could get that lump checked out. And I did, and it turned out to be cancer. I also found out that I had a genetic mutation that put me at higher risk for the rest of my life of getting breast cancer and other forms of cancer. Had I not had the ability to go to a doctor and not have to worry about the coverage for that health care, I might not be standing. I likely wouldn't be standing in front of you today. And that is the fate that this big, ugly law has put millions of people in. Because what happens to a woman who comes to Crescent? Or now, a woman who is covered by Medicaid who comes to Crescent, when she finds a lump herself like I did, she has the ability to get the kind of care that I had access to. But when she loses her Medicaid, and we heard from the folks here at Crescent today that folks are already, their numbers have already started to drop in terms of who are enrolled. When she can't go to the doctor after she finds that lump, then she'll likely, if she ever is able to get health care, end up getting diagnosed when she has to go to an emergency room. And she'll be at a much later stage cancer. And her treatment will be much more involved. The hell that someone in those shoes will go through is cruel and completely preventable. But the cruelty is the point with the Republicans who passed this law. The cruelty is the point. They apparently ran for the different reasons than we all did. I want to make sure I remember hearing the words of my parents from the time I was the smallest. Debbie, if you don't have your health, you don't have anything. And unfortunately, I experienced that admonition firsthand, and millions more will experience the impact of understanding that when they don't have their health and they can't get access to the health care they need at the earliest stage, because that's how we save lives and keep people healthy, then we are going to have devastating impacts that are absolutely unacceptable. And we're going to crisscross this country and make sure we educate more people and put the human face that is so essential on the impact of this big ugly bill. Our goal is to make sure that we can save lives, keep people healthy, make sure that all the goals and aspirations that Leader Jeffries just talked about are attainable by everyone, not just the wealthiest, most fortunate Americans who the benefits of this bill targeted. Thank you so much. And now it's my privilege to introduce the Honorable Robin Kelly from the great state of Illinois, a senior member of the Energy and Commerce Committee.
Thank you, Debbie. Thank you all. And I want to thank Troy Carter, who's been a wonderful host, and you guys are so lucky that he represents you in Congress, because he is truly the best. I also want to thank Alice and Crescent Care and your team. The people of New Orleans are so fortunate to have you. We need more of you, not less of you. I feel like I'm with my people. My background is social service and mental health, so I can relate to all the things that you're talking about. And as a chair of the Congressional Black Caucus Health Brain Trust, I know we have so much work to do to make sure that you survive and FQHCs across this country survive. And also the other thing is so many hospitals. They talked about 33 hospitals in Louisiana may close. I have 9 rural hospitals in my district, or in Illinois that might close too, or in my district. So even if people can't come here and they wait and they don't get their health and they say they want to run to an emergency room, there may not be an emergency room for people to come to. So as you know, we say, people are going to die because of this bill. And I just don't want people to get weary or frustrated, because as you heard, we are going all over this country to educate people, to inform people, to let them know what we're going to do about this. We're not going to get weary, and we don't want you guys to get weary either, no matter how frustrating it seems. And when you think about it, it's about healthcare, but also people are going to lose their jobs if hospitals close. It's going to have a devastating effect. I represent a lot of small communities. I have 4,500 farms in my district, and it's going to affect the whole community if the hospital system closes. But thank you for having us. It's so interesting being here in the home of Mike Johnson and Steve Scalise, who were celebrating last week. I hope people keep that image in the forefront and in their minds of who was leading this effort with Donald Trump to take health care away from people, to take food away from people, to take jobs away from people. Please don't forget that. But thank you for having us. The town hall meeting was fantastic, and we are your partners, and you are our partners in this fight. Thank you. And our closer, my colleague from California, Nanette Barragan.
Thank you. My district is in Southern California, so you might wonder, what am I doing here? Besides being a co-chair of steering a policy which is taking this on the road, educating people about what we're working on, what we're doing, the laser focus right now is on this bill. It is what is going to be the impact to the American people. And that impact is going to be huge, both to Democrats and Republicans. Healthcare in America should not be a Democrat issue or Republican issue. It's an American issue. And we have been fighting to make sure as many people are covered. It boggles my mind that the Speaker of the House, who represents the state of Louisiana, would not do what's in the best interest of the people of Louisiana. And to even have the state legislature, controlled by Republicans, implore the Republicans in the U.S. Congress and say, please don't do this, is pretty heartbreaking and pretty shocking. But we have to make sure we tell the American people what that means, and that means we have to come here to tell Louisianans what that means. And what that means is, this year, you're going to start feeling the impact. This year, if you get your health care through the Affordable Care Act, the marketplace, you may no longer be able to afford your health care because they didn't think it was important enough to renew subsidies and dollars. Instead, they thought it was more important to give tax breaks to their rich friends and billionaires. So that will start to happen this year. So if you lose health care, you can thank your speaker, and you could thank their leader, Steve Scalise, for that. What's going to happen then? They're going to either be without health care, end up at the hospitals, which means what? Longer wait times. I don't know about you here, but we hear about it in California all the time. The wait times are long enough. We don't need longer wait times. That will happen. People will get more sick because they're not going to have preventive care. And then people will come to places like Crescent Care to try to get some coverage, some care. We know that right here at Crescent Care, they serve over 13,000 patients. And 33% of the patients that come here are relying on Medicaid. And one of the most fascinating statistics I heard today as I was on the tour was they used to cover 43% of people, their patients were on Medicaid before the Medicaid unwinding. That was a period of when people had to renew their Medicaid benefits more often. Guess what this bill does? It's going to require you, the people, to have to renew and prove that you deserve Medicaid every 6 months. When that happened under Medicaid unwinding, Crescent Care lost 10% of their patients. So I don't even want to imagine how many more people are going to lose Medicaid because just from that burden of the paperwork and having to renew. So as my colleagues have mentioned, this is going to have a devastating impact across the country. We know that this center here, this community clinic, serves a high number of people who are in historically underserved, don't have access to care. That's very much like my district. And so this community center is like many across the country. And so we're going to continue to fight back to make sure every person has the ability to get health care and do whatever we can to reverse this so we cover the most number of people. And so with that said, we just have to continue to tell people about what this means to them and when they're going to feel the impact, and that will start later this year. Thank you.
I am so grateful to Leader Jeffries and these amazing members of Congress for coming, leaving their own home states, where the battle's going on there, to come to our home state, to amplify what has happened, but more importantly, to amplify that we aren't quitting. The leadership here fights every day. I could not be more proud to serve beside them, behind them, and with them. Thank you. I want to give another big shout out to Alice and Sarah Jane. Where did she go? My dear friend, who's a star. To all the people of Crescent Care who put in the long hours, demonstrate the love for the patients, and even in light of all that's going on, you guys still show up. We appreciate you. Happy to answer a few questions. Yes, Sabrina Wilson.
Yes, good morning. Even as you're at this healthcare facility, do you share the concerns of medical students and aspiring medical students who fear they will not be able to get adequate federal loans to cover their educational expenses?
Absolutely, we do it on twofold. One, to get to and through medical school, the reduction in the funds that will be available, but then also for our research scientists who are watching in real time NIH dollars go away, National Institute of Health research dollars, where many of our best and brightest will choose to go somewhere else because they're fearful that research doesn't matter as much. Last week, we had Robert F. Kennedy Jr. before our committee. I asked him about the cuts to HIV AIDS research, and he said to me, and I quote, "They've taken too long to come up with a cure, so we're canceling the funding." Now, what sense does that make? We may not have come up with a cure, but we certainly have come up with advances, medicines that people are living longer with. And because you haven't come up with a cure, you cancel the research? Are you going to also cancel research to cancer? While we're fighting to come up with the answers to these dreaded diseases, yes, we're absolutely, ma'am, concerned about our young students who we need to encourage to become doctors. Xavier University, my alma mater, is building as we speak a brand new medical school right here in the heart of New Orleans. We've got to make sure that our students of all backgrounds, all genre, have an opportunity to study. And we're going to continue fighting against these cuts that will discourage people from going to medical school.
Yes, question for Leader Jeffries. How significant is Democratic control of the House? What would it mean for the final 2 years of Trump presidency? And also, how central will this new law into the be in terms of the national narrative and individual district races?
Yeah, the one big ugly law will rip away health care from millions of Americans, including hundreds of thousands of people here in Louisiana. It takes food from the mouths of children, seniors, and veterans by enacting the largest cut to nutritional assistance in American history. And all of this damage that is being done to everyday Americans is in service of massive tax breaks for billionaire Republican donors. That is not acceptable. We are better than that here in the United States of America. And so the fact that Republicans made the decision to ignore what is in the best interests of the people they represent and instead have jammed this extreme budget reconciliation bill down the throats of the American people will certainly be a central issue as we present our case to the American people in connection with the midterm elections in 2026. We have a very different vision for the type of America that we should be fighting to bring about here in this country. We want to move the country forward. The extremists are trying to turn back the clock. We are fighting to bring people together. The extremists are tearing America apart. We want to build an affordable economy that makes life better for everyday Americans, and the Republicans are determined to bring about an economy of the billionaires, by the billionaires, and for the billionaires. And central to that debate and discussion that we will have over the next 16 months in America will certainly be the one big ugly law. The American people will have an opportunity to move this country in a better direction in the midterm elections. And if you want a Congress that is actually going to stand up for everyday Americans, as opposed to being a reckless rubber stamp for Donald Trump's extreme agenda, the American people will have that opportunity in November of next year.
Hi, this is for Leader Jeffries. You mentioned the Senate concurrent resolution, bipartisan, unanimously supported, but those state lawmakers are now going to be charged with implementing the changes in this law. I wonder what your message would be to them as they put them out doing that.
We are going to work as hard as we can to roll back the damage that the one big ugly law is going to do to the health care of the American people as quickly as we can. But we need continued voices of Democrats, independents, and Republicans, such as those in the Louisiana state legislature, to continue to make the case as to how harmful these health care cuts will be to the quality of life of the people here in Louisiana and, of course, across the country. Our message to the Republicans and the Democrats in the Louisiana state legislature is simple. Members of your own GOP party won't fight for the people of Louisiana and their health care. We will. We will.
I was wondering if you could talk about the opportunities that Democrats will have to try to walk back the changes created with this bill, and if that's not possible, are there opportunities for funding to help people like pressing care deal with inflation?
Well, I think let me yield to Troy Carter and some of the other members on this, because Representative Carter and the members, particularly of the Energy and Commerce Committee, have been particularly focused on this issue. The assault on health care contained in the one big ugly law is unprecedented in scope. And our commitment is to use every legislative tool available to us to roll back the harmful consequences of this bill now. And we certainly will be more empowered to do that if the American people make a decision that complete Republican control of government isn't working for their quality of life, and they decide to move things in this country in a different direction in the aftermath of next November, where we will have additional tools to stop the carnage and the damage that this Republican budget reconciliation will do to the people of Louisiana and folks all across the country. Hospitals will close, particularly in rural America and rural parts of this state. They will close. Nursing homes will shut down as a result of this one big ugly law. And community-based health clinics, such as this one, won't have the ability to provide the compassionate and comprehensive care to many of the people they have previously served. As a result of this, folks will die here in Louisiana and in other parts of the country. This debate on the House floor, it was a crime scene because of the consequences that are going to unfold for the American people. That's tragic. But we're urging people not to give up hope, because we're going to fight hard until we get this situation turned around.
And to piggyback on what the leader has said, and to further answer the question, we're going to use every tool we have. We're going to, this big ugly bill passed, this big ugly law exists, but we know that there are multiple components to it. We're going to keep watching in every committee on energy and commerce in which I serve. We're going to keep taking our message to the people. We're going to find every opportunity to tweak, change, repeal. Certainly we'll have a better opportunity after midterms, and they were very crafty in how they set this up. They set this up so the bulk of this, you will feel the pain after midterms. So they can go out and try to get reelected saying, see, it didn't hurt you. Well, it's starting to hurt today, and it's going to hurt a whole lot more after the midterms. we won't let the American people be hoodwinked by the trickery of trying to hide the devastation of what this law will cause. In the appropriations process, there are components of this bill that will still require discussion and vetting. And I'm going to ask one of our appropriators who are here with us today to speak a little bit to that, Debbie Wasserman-Schultz, who is a senior leader on the appropriations bill, to maybe zero in on a little bit of that.
Thank you. Thank you, Congressman Carter. So we are still in the midst of the appropriations process now, and just because Donald Trump has signed the big ugly bill into law doesn't mean that, you know, we just lay down arms and call it a day and, you know, live to see what happens with the results of the election. The election results are going to be very critical, but we have multiple opportunities this year and in the next fiscal year when we're going through the FY 26 and 27 appropriations processes to use the amendatory process. We will run amendments to put Republicans on the spot and make sure that we are advancing policy to reverse the really most terrible impacts of this big ugly law. We can do that in multiple different appropriations bills. There are 12. We've been through about 5 of the appropriations bills in a markup in committee already, but we've got 7 to go. And every opportunity that we have to hold their feet to the fire, we're going to. And so Speaker Johnson and Steve Scalise and every Louisiana Republican member of Congress is going to have an opportunity to decide whether they want to support the continued implementation of this big ugly law, or if they want to heed their own legislators and roll back the most damaging, harmful processes and not allow people to have their health care yanked away from them. And we're going to make them choose over and over and over again.
But also, that's why your voices are so important, that you keep the pressure on them, so when we put the pressure on them, they also have the pressure on them from their own citizens.
Yes.
So people are going to fall off because of paperwork, not necessarily eligibility. Or is there anything that you can do about that, or anything you're looking at?
Yes. The question was, people are going to fall off the rolls because they have to, twice a year, they have to recertify. And I'll tell you what I've said publicly. If you had to renew your driver's license every 6 months, there'd be a whole lot of people driving without insurance and without driver's license. They're expecting the same thing to be true, to clutter the system with bureaucracy, with hopes that people who are busy living, caring for their families, educating their families, housing and feeding their families, to have to reapply in an onerous process with hopes that people will get busy, forget, or put a comma in a place that should have been a period and be denied. We are going to work closely with organizations like this one, to work with nonprofits, faith-based, community people, all of our people, to encourage people at those benchmark times to, in Louisiana, LAO2, in my district, we do what we call LAO2 curbside. You've covered many of them, where we go to the community and we set up pop-ups and we assist people with their paperwork, assist them with making sure that they are maintaining their eligibility. We will do that on steroids across the country. With the power of our Democratic caucus, I'm the first chair of the Congressional Black Caucus, we're going to weigh in. We're going to weigh in with the Tri-Caucus, and we are going to collectively continue this discussion of educating people of what they need to do to maintain their eligibility. We're going to prove them wrong that this bureaucratic trap, and that's what I call it, a bureaucratic trap of hoping people would miss the deadline and thus fall off the rolls. We're bigger than that. America's bigger than that, and we're going to prove that we're smarter than them, and we're going to fight to make sure people don't lose eligibility. Yes, sir. Yes.
We're going to launch an organizational effort that is community-based, unlike anything that the state or country has ever seen, to try to make sure that as many people as possible can retain their Medicaid coverage. It is important to note that these red tape requirements were put into the One Big Ugly Law with the explicit purpose of kicking people off Medicaid. That was the purpose of the massive, unprecedented red tape paperwork requirements that will now be imposed on the people of Louisiana and everyday Americans all across this country. It was done to try to reduce the cost of this bill, which is already going to explode the debt by more than $3 trillion, and to make sure that the billionaire tax breaks that are a part of this bill are paid for by everyday Americans here in Louisiana who are going to lose their health care. This is an unbelievably cruel thing to do. And we're going to make sure that we use all of our organizational capacity to allow the greatest number of Americans to fight through this bureaucratic red tape paperwork trap that is being imposed on them and continue to get the access to the health care they need to live a life of dignity and respect.
Yes.
In addition to the resolution that was passed in the state legislature, there were also, Senate bills that were passed into law that were program integrity measures. And Louisiana's Governor Jeff Landry talked about going above and beyond the Trump administration's, Medicaid cuts. Do you feel like Louisiana faces unique challenges as it relates to eligibility requirements that may be included in Medicaid?
1/3 of the people of Louisiana depend on Medicaid. 50% of children that are born with the aid of Medicaid. People living in nursing homes, people living with disabilities, all depend on Medicaid. In Louisiana, in my district, and in all 6 congressional districts, Governor Jeff Landry once served in Congress. He understands what a fiscal hole this will leave in his budget. And when this budget comes, they will only have 2 options. Either increase fees or roll people off of the benefits. What ends up happening? Rural hospitals, 33 in our state, will close. Nursing homes will shutter. People will suffer. No governor, Republican, Democrat, or other, wants that to happen to his state. And so I will tell you, when the Senate and the House of Louisiana, both bodies that I'm proud to have served, pass unanimous resolution saying, don't do this. It wasn't in the blind. It was because they know what it will do to the people. They know that people will die. They know that hospitals will close. They also know that it will put an incredible strain on their budget. When I was in the state Senate, we expanded Medicaid. When we expanded Medicaid, 638,000 people became eligible and came on the rolls. Rural hospitals started opening. The reverse is also true. When you see this end roll out, this Medicaid cuts, rural hospitals will close and people will die. People will come off the rolls. We'll put an additional strain on emergency rooms. It's not rocket science to understand that curative care is a lot more expensive than preventive care. Medicaid represents preventive care. Curative care represents people that will bypass all of their opportunities to be healthy and then end up in the emergency room, putting a strain on the system. I think you're going to see a different step and call from our governor and from the members of the legislature who said in one voice, hands off Medicaid. Thank you all for being here. We greatly appreciate your time, your patience. I want to again thank our incredible leaders behind me for taking time out of their schedules to be here in Louisiana, demonstrating the importance of our state, demonstrating the importance of our country. Again, I want to give a shout out to Alice and Sarah Jane and the entire family here for the great work that you do, and thank you for allowing us to be here. God bless you all.
Present care, people. Present care, people first.